So if I was to do a brow lift, upper eyelid, lower eyelid, and fat transfer, which is kind of the complete package for upper face rejuvenation, that surgery takes about 2.5 hours to do total. You'll wake up in the recovery room, you'll have a wrapper on your head, it'll feel sore, it'll feel tight, but you're not going to feel any sharp pain. You may have a headache, and sometimes we even give you a caffeine tablet to help that headache go away in recovery. We also do a nerve block at the end of surgery so that you're not going to feel any pain throughout your face, kind of like coming out of the dentist and being numb. So we do no narcotics during surgery because you don't need them. You don't need narcotics when you wake up. So very easy on your stomach, very little nausea, no vomiting at all. And you'll have a little wrap around your head, but you're able to open your eyes. It'll be a little blurry because we put quite a bit of gel and things like that in your eyes to protect it. But you'll feel pretty good. You'll go home, you'll watch some TV, put a little cold compress over your eyes, keep that on for about 20 minutes, take it off for 20 minutes, and get through that first night. It'll never be a great night of sleep the first night, but most patients feel like it's not that uncomfortable. Half our patients take pain pills the first night, half do fine with just Tylenol and some cool compresses. The next day I'll see you in the office. We'll take that wrap off your head. We'll take a look at everything and we'll see there's very little bruising because we haven't done anything to the muscles of the lower eyelid. You'll be a little swollen, but you'll feel pretty good. And once that head wrap comes off, it doesn't have to go back on again. That week we'll send you home for the week. You're up, you're walking around, going for nice long strolls. Just no cardiovascular exercise for 2 weeks. We don't want these blood vessels to open up. We don't want to cause any bleeding in the fat. We don't want to cause any bleeding on the muscle so that the speedy recovery continues. At 1 week, if we've done stitches for the upper eyelid, we'll remove them at 1 week. Again, no staples for the brow lifts. We remove stitches at 1 week for the brows as well. And generally, there are no stitches to remove for the lower eyelid. At 1 week, if you had any bruising, it's usually turned to yellow discoloration. And at 10 days, it's safe to put makeup on to cover up any lingering bruising. So we also use the Elixir MD light-based therapy device that uses yellow light, blue light, and red light to speed up the recovery, take away swelling and bruising even faster. And we found that a great improvement in the speed of our patients' recovery. At 10 days, most patients are back into the community and feeling like they can hide any lingering swelling. 2 weeks, they're mostly back at work. 2 weeks, you can start doing some cardiovascular exercise. But if you do things like yoga, Pilates, anything where you're inverting your head, that takes about 6 weeks before you're ready to do that. 6 weeks is also the point where most people feel like they're ready to go to an event like a wedding or dinner out with friends, where again, they can hide some of the lingering swelling and feel confident when iPhone photos are taken that they look good. Our before and after photos are usually kind of at the 4-month point. That's when the swelling's gone down enough that we're not going to see it in high definition photos with our before and after cameras.